The procedure I want to show you now will be removing a needle from a portacath and then re-accessing that. We do this on a weekly basis for anybody who has a portacath in place that is accessed and being used. So the first thing I'm going to do, I have of course washed my hands and gloved and removed the dressing. I then removed my old gloves and gelled my hands and put on another set of gloves. So I will grab this portacath by its little wings up here. I will secure it with my fingers so it doesn't wobble and it doesn't wiggle or doesn't pull when I remove the needle. This is one of those safety needles. When I pull it out, the needle will be encased in plastic for your safety. So I'm going to secure this port so it doesn't wiggle, and I'm going to say 1, 2, 3 and pull the needle out. It would normally come out, once you grab these white wings, it will come out to encase this needle in plastic to protect the nurse from any needle sticks. And that's the safety part of this particular type of needle. You will see different types of fibers out there. This is just one type. The next thing I would like to show you is, this is a portacath. I'm going to remove the port needle, take the port out so you can take a look at it and see what an actual port looks like to give you a good visual of what you're working with underneath the skin. Because unless you've been involved in putting one in or in a class like this, you might not have ever seen what a port looks like. So of course I've washed my hands, donned my gloves, and removed the old dressing. I'm going to grab these wings, secure this port with 2 fingers, grab the wings and pull directly up in a quick motion, 1, 2, 3, up. That's how you remove your port needle. Of course, dispose of this in your sharps container. Now I want to show you what goes on underneath the skin. This is what an actual port looks like. It's the ones that they use, of course, are made of metal. This middle part is like a rubber stopper area, and underneath, inside, also has a rubber backing. What you need to do is access this port at a 90-degree angle. That's the goal of accessing the port properly. It generally lies flat underneath the skin. They can lie on an angle. They can migrate a little bit. And one thing you need to remember is that you're accessing your port at a 90-degree angle and not necessarily accessing your skin at a 90-degree angle. So the next thing will be accessing the port itself. Now, to access your port, you've of course explained the procedure to your client and they're probably quite familiar with it. You will need to gather your equipment as we showed you before. Get your client in a comfortable position. Some people like to lie down, some people like to sit up. Children often will sit on their parents' lap. It just depends on what works for the client and what works for you. The nurse has to be in a comfortable position to do certain procedures because if you're not comfortable, it makes everything else uncomfortable. The mom won't be comfortable, the child, nor the nurse. And you do your best work when everybody is settled in and knows what's going to happen. After I removed the old dressing, I removed my gloves. And I had already prepared my equipment. I had opened it up. You will need your syringes, your Huber needle, and your open case, your open dressing kit. Prior to putting my gloves on, I'll don my mask. I will gel my hands again. And once they're dry, let them air dry, we'll go for our sterile gloves. You'll see that I've opened up my equipment so everything is easily accessed. I've donned one sterile glove. What I'm going to do now is show you how I prepare the Huber needle for access. Now, since I have a sterile glove on, I can handle everything sterilely. And what I'm going to do is take my cap, take my saline syringe, and attach it to my cap. I will then attach my cap to my Huber needle. And prime it. So we're ready to go. Then I clamp it. I can then again go ahead and don my other glove and proceed with the access itself. Since I'm sterile, I can remove everything out of my packet. I'll spread this out as a sterile field. Most of your dressing change kits will have a sterile field within them. This is your ChloraPrep scrubber. This needs to be used in the whole area, anything that's going to be underneath the dressing or extending, an inch or two outside of the dressing. To get this activated, you squeeze two little side things, and you'll see it come out onto your sponge. And this is a scrubby back and forth motion. You do this for 20 seconds in the entire area that you're going to be covering. So scrub it back and forth. That's 20-second scrub. And I always set this back inside my sterile field in case I need it again. And now we need to let this air dry. And that will take up to 30 seconds. It will vary. While that's drying, I'll prepare my needle. These Huber needles have a little protector on them. You need to grab it by the wings. This is what your Huber needle looks like. It's a 90-degree angle needle. So it's got two little wings on it and a protector on the needle itself. You go ahead and remove this needle, the protector rather. Once your poured area is dry, you secure it on all sides, or on at least two sides with your fingers so it does not slide. And you enter your port at a 90-degree angle. 1, 2, 3, 90 degrees. You can feel it hit the bottom of the port, and then you know you're in. I've done this whole procedure completely sterile. All right, now that our port is accessed, I need to flush it. So this is the first time I'm breaking sterile technique, is when I touch this syringe. If you look back on the procedure, you'll see that everything has been done under sterile technique up to this point. So I'm going to flush, and it flushes nicely. Pull back. I should get a nice blood return. If I don't, there's a couple things you might do. You might try rotating this needle. You might try to reseat it. By that I mean lift it up a little bit, not take it out of the skin, and reseat it into another position. You might have the client raise their arm, cough, deep breathe. Those are some of the techniques that might get this to flow a little better. So if you find that you get a blood return, you flush it and set it back down. Now we're going to cover up your dressing. Cover up your port needle with your dressing. This particular dressing kit has an op site in it. This is one of the various dressings you'll find out there. And you want to cover the center of your port needle as if it was a little island. Make a little island out of it. You can position this tubing however works. Take your dressing, set it gently over the area you want to cover. In this case, you would like to avoid people's nipples. That is always a good thing, especially for men, because usually women's ports will be placed higher. Secure all your sides, and then you can remove the edges of the dressing like this. Now that I have secured the dressing, I can take my gloves off and secure the outside of it. This is one of my favorite ways to secure a dressing. You take your tape, like this, make a little notch in it. This will minimize your adhesive exposure to the skin, and it's a very secure way of keeping a catheter from jiggling back and forth. So you see I've made a little notch, and I've torn off the end of it. This little notch will slip under your dressing like this. Just like this. And then this part will go over it. You will find that this is the most secure way you've ever secured a dressing. This is not going anywhere. Make sure this is all tapped down. Feel this. You could always put more tape if need be, but I personally am a minimalist when it comes to tape exposure. This is how I like my dressings to look, nothing underneath. If you happen to have a long needle that sticks up above the skin or a port that stands high above the skin, you may need to use these some gauze underneath the wings. But I caution you to always leave the insertion site visible, so it can always be seen and always be observed for problems and assessed on a daily basis. And that's how you access and secure your PortaCath. The very last thing you do after you've accessed your port is to flush your line with heparin. We've already flushed it with saline, so we're going to go ahead, clean your tip with alcohol, prepare your syringe, attach, push and screw, and flush with heparin. Remove your syringe. Last thing you do is clamp your catheter. And there you're done.